When do you need to go to the emergency department for a head injury? I see a lot of patients come to the ER because they hit their head and they really didn't know if they need to be seen or not. Head injuries can be really scary. I'm sure we've all heard the story about somebody who was hit in the head with an object, they seemed fine, they went to sleep that night, and then they just didn't wake up the next morning. This pops up in the news every so often. It kind of perpetuates this belief or this fear, and it's passed on. It seems like generation to generation. So I see a lot of patients come in because they really just don't know if they need to be seen or not. So this video is going to break down when you don't need to come to the emergency department after sustaining a head injury. Most head injuries overwhelmingly are pretty minor and don't cause any significant damage. They might cause bruising, they might cause some bleeding, some lacerations, but very rarely do they cause significant traumatic brain injury or bleeding inside of the brain. This video, I want to start with this specifically though. If you take blood thinners, this video is not for you. If you're on blood thinners, that includes Eliquis, Xarelto, Warfarin, Pradaxa, any of that, and you hit your head, you need to go to the emergency department every single time because you're significantly high risk for bleeding, and these rules don't really apply to you. So I'm going to go through a series of red flag signs that if you or somebody that you know hit their head, if they develop any of these symptoms, they should be seen in the emergency department. First one is confusion. Confusion or altered mental status. They hit their head and now they're not acting like themselves. Sometimes they're somnolent, they're slow to respond, they're just generally not acting like themselves. They're not very alert. Those patients should come to the emergency department because there's concerns that there's something going on in the brain. Another one is seizures or any neurological symptoms. Seizures are a huge red flag because really that means that there's structural damage or some form of irritant to the brain itself. And that's usually caused by either blood in the brain or swelling in the brain. And this causes the seizure activity. But this also includes any other neurological symptoms such as numbness and tingling, weakness to an extremity, anything like that, you come to the ER immediately. This one's actually probably surprising for people, but it's two or more episodes of vomiting. And this is because multiple episodes of vomiting can be a sign of increased intracranial pressure or increased pressure inside of your skull. And again, that's usually caused by a buildup of blood or swelling in the brain. And if this continues, it can cause significant damage to the brain. It can put pressure on it, it can cause things to shift. And sometimes this requires actually surgical intervention or certain medications to try to lower the pressure. So if you develop multiple episodes of vomiting after a head injury, you go to the ER. Um, and then the fourth one is it's dangerous mechanism. And this can mean a lot of different things, but there's a few things that if you meet this criteria, you need to come. One of them is if you're ejected from a motor vehicle. If you get in a car accident and you're ejected, come to the ER. If you're a pedestrian hit by a car, if you're riding a bicycle and you're hit by a car, especially if you don't have a helmet on, you should come to the ER. And lastly, any fall higher than about 3 feet and you hit your head, you should come to the emergency department. And I want to just touch briefly on pediatric patients because I see a lot of parents come in, they're very concerned if their child sustains a relatively mild head injury, and they have a little more or a little bit different criteria that should require evaluation. And but theirs is starts kind of the same, and it's just altered mental status or confusion or not acting themselves. Are they asking repetitive questions? Are they more tired than normal? Oftentimes than not, these patients have been up for a long time because they're hurt, they're crying, so they probably are a little more tired, but it should be an abnormal amount of tiredness. They're just generally not awake. Um, Slowed responses is another one. Anything like that, come to the ER. And then I guess lastly, you know your child. If they're just not acting like themselves, come to the ER. There's usually something wrong. Parents' intuition is usually right, and I trust that more than any of these algorithms or even studies, really. Um, and then same thing, severe mechanism. Again, fall higher than 3 feet, ejected from a vehicle, hit by a vehicle, come to the emergency department. Overall, head injuries are relatively minor. They very rarely cause any significant bleeding, traumatic brain injury, or require anything. But if you develop any of these symptoms, or I'm sorry, if any of this applies to you, really, you come to the ER more often than not. We'll get a CT scan of the head to look for any bleeding in the brain or any shifting of the brain tissue caused by intracranial pressure, and you'll get a full neuro exam. Um, but I would say more commonly, a lot of pediatric patients that come in with head injuries don't really meet this criteria, and it's more so just for comfort, because it is scary. It's scary to think about your kid going to sleep and not waking up. But I'll end with, if you develop, or really if anything happens to you and you get a head injury and you're just concerned in general, maybe none of this applies to you, but you're concerned, you're really anxious, you come to the ER. Like I said, it's better to be safe than sorry. It's better to get checked out. We're there 24/7 and we're willing to see anybody who comes in. I'd much rather somebody come in, be reassured, than they stay home and something terrible happens.